behalf of Nash 24/7, I welcome you to our public awareness program on Defeat the Silent Killer Nash. Nash 24/7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. To speak on Defeat the Silent Killer Nash, today we have a renowned gastroenterologist, Dr. Nikhil Sonthalia from Kolkata. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. Nikhil is a leading gastroenterologist in Kolkata, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has over a decade of experience building a clinical skill set that allows him to deliver patient-centric care. He is currently practicing in Apollo uh, Hospital, Kolkata. On International Nash Day, we salute your dedication, sir, towards spreading awareness related to liver health and disease. So now I invite Dr. Nikhil to enlighten us to the topic. Over to you, sir.
Thank you. Thank you for such a kind introduction. Thank you for this opportunity to discuss with the audience about this very important topic, NASH, which is a common condition, but it lacks awareness in general population, and it is growing in popularity in terms of its diagnosis and management over the last 1 decade, I would say. So I'll just briefly take you through what exactly NASH is. I'll be talking in a very simple language, and I like to have interaction at the end if required. So this International NASH Day was launched in 2018 by Global Liver Institute, and it is celebrated across the globe on second Thursday of June month. The aim is to raise awareness about this entity and the actions people can take to prevent the disease. So the theme for this year is Step Up for NASH. This year, Global Liver Institute is inviting all to step up for patients, step up for early detection, step up for advocacy to defeat NASH. So I'd like to thank the industry partner Zydus, who has been an official partner of this Global Liver Institute to do various awareness activities around International NASH Day. And they have been celebrating their 6th International NASH Day this year. So to explain in simple terms, the liver is very, very important, and it is the second largest organ of human body, weighing up to around 1.5 kilograms, which constitutes normally around 5% of fat. Liver is anatomically located in right upper portion of your abdominal cavity on top of your stomach and intestine. If you see a normal healthy liver, you can see it as a pinkish brown in color, soft in consistency, and is highly vascular. So the liver serves many, many important functions, which is paramount of importance for normal day-to-day activities of almost all organs of the body. So liver helps in destruction of old RBC, liver helps in processing nutrients, regulating blood components, production of biles, production of protein and cholesterol, breaking down of alcohol and other medications, and control of other metabolic processes. So NAFLD is a condition in which the normal 5% of fat that liver is made up of, it increases, which is not caused by alcohol use. If left untreated, it can progress to NASH. So being overweight or obese, having type 2 diabetes or high cholesterol are the factors associated with increased NAFLD. So to give you the grave prevalence of this condition, I'll just tell you this important fact that 1 out of 4 people have NAFLD regardless of their weight. More than 6 diabetes and 9 severely obese people have, out of 10 have NAFLD. So even if you don't have any risk factor, genetically you are predisposed to having NASH, which is a common prevalence of up to the tune of 25% in general population. But if you have a comorbid condition like morbid obesity or diabetes, then your chances of having NAFLD is very, very high, up to the tune of 80 to 90%. Male gender is also an additional risk factor after having NAFLD to progression to NASH and fibrosis. So how does this is not a one cross-sectional disease, it's a spectrum of disease. So a normal liver transforms to a fatty liver, which is caused by deposition of fat, which is causing enlargement of the size of the liver. This is the first step in the pathogenesis of end organ damage. The next step comes liver fibrosis, where this deposit fat causes a lot of inflammation and scarring in a repeated cyclical attacks, which ultimately leads to scar formation in the liver, which ultimately leads to destruction of liver cells and formation of cirrhosis, cirrhotic nodules, which leads to failure of liver to function normally. So our aim is to detect this NAFLD at an early stage of fatty liver and prevent its progression to liver fibrosis and then subsequent cirrhosis. So two entities that we as a gastroenterologist or a hepatologist, we need to identify whether the patient is having only fatty accumulation in the liver, which is non-alcoholic fatty liver disease, or they are having fatty accumulation plus inflammation and scarring. Because anybody who's having scarring is an harbinger of progression to severe fibrosis and cirrhosis. So as I told you, external factor, environmental factor, plus genetic factor play in tandem to lead a patient from normal liver to fatty liver to NASH to cirrhosis. Obesity with genetically predisposition, with type of lifestyle, including food intake, sedentary habits, inactivity, exposed to certain medication, associated metabolic syndrome, all this contribute in tandem to cause NAFLD. So being overweight or obese causes fat to accumulate in liver. Obesity increases the amount of fat to constitute of 5 to 10%. This is good enough to lead to NASH and scarring of liver. Diabetes is a very, very common household problem in India, which is becoming a pandemic. And NAFLD and diabetes are interlinked with 2 to 4-fold increased risk of developing NAFLD in diabetes, similar risk of developing diabetes in NAFLD. So if you talk about symptoms of NAFLD, most of the cases of NAFLD are detected incidentally when they are undergoing upper GI and when they are undergoing ultrasonography of abdomen. However, there are certain mild features which may be ignored for a long time, like presence of mild fatigue, presence of discomfort or pain in right upper abdomen. All this can be present when the fat accumulates in the liver and there is stretching of the liver capsule due to enlargement of the liver. NASH once develops, patient develop increased fatigue, nausea. There may be developing early signs of ascites where the abdomen becomes distension. You may get signs of early encephalopathy where there starts becoming confusion state. They may have decreased appetite or loss of appetite, easy bleeding diathesis like easy bruisability, edema, the swelling of your feet, unexplained weight loss, yellowish discoloration of your eyes and skin, and presence of upper GI bleed. So these are all grave symptoms, but most of the patients have mild or no symptoms. So diagnosis of NAFLD requires combination of blood tests, ultrasound, liver biopsies, if in certain cases, X-ray, CT, and MRI. So not all tests are required in all the patients. You have to select your patients and then select the test accordingly. Persistently elevated ALT. A common blood test is liver function test, which measures your ALT, AST, total bilirubin, total protein, alkaline phosphatase. In that, there is a parameter called ALT. If that is persistently elevated, it is a harbinger or a suggestion that the NAFLD is progressing. Patients with normal ALT can also develop progressive disease. In fact, up to 80% of NAFLD patients have normal ALT. So there is no optimal cutoff for prediction of NASH or fibrosis based on ALT, but a high ALT definitely suggests progression. So combination of different blood tests and parameters like age, AST, ALT, and platelet count, which is done very routinely, we can give you a score which can tell you whether you are a high risk to progression to fibrosis. Similarly, FIB4 score and NAFLD fibrosis score, which includes age, AST, ALT, platelet, BMI, glucose, albumin, which can be done with a very routine, basic, cheap blood test. We can give you a prediction that how chances are of you progressing to severe fibrosis. Ultrasound is a common modality which has both its benefits and disadvantages. Advantages include it is an easily available modality, it is economical, cheaper in many of the states and cities. And this is the reason where most of the NAFLD is diagnosed, as patients are advised in ultrasonography for some other non-specific complaint and you detect the fatty liver. The disadvantage is it's a qualitative test. It doesn't give you quantification of fat and it only detects fat when it is to the tune of at least 20-25%. And second, it cannot differentiate between a fatty liver versus an advanced NAFLD, which is NASH or fibrosis. So another non-invasive test is fibroscan. So fibroscan is a method by which we measure stiffness of the liver. As NAFLD progresses to fatty non-alcoholic steatohepatitis, where there is inflammation and scarring, the normal soft liver becomes inflamed and hard. As the stiffness increases, the grading of fibrosis increases. So fibroscan is a very good modality to differentiate a simple fatty liver from fibrosis. Because if you get a high fibrosis score on fibroscan, we have to closely monitor you and give you proper treatment to prevent you from progressing to NASH. The disadvantage is you cannot do it in very severely obese patient. Other things that works on principle of this transient elastography is liver stiffness measurement and controlled attenuation parameter. These two are the indicators which give you relative stiffness of the tissue and relative percentage of fat in your tissue and your liver. Other very sophisticated and high-end modality, which is not present in most of the centers in Eastern India, which is present at Apollo hospitals currently, is MRI PDFF. It is a kind of a modified MRI imaging of liver, which gives you proton density fat fraction. It is considered to be a gold standard to detect fat content. It can measure fat content as low as 1%, and it is a widely used technique for liver donor patients who are prospective donors for liver transplant. The disadvantage with this technique is you require a dedicated software which is not easily available and it's quite costly. Liver biopsy, of course, cannot be done routinely because giving the high prevalence of NAFLD in day-to-day community and a large population, you cannot keep on doing liver biopsy. But in certain high-risk patients where non-invasive parameter shows high chances of cirrhosis, who has otherwise risk factors, we do consider liver biopsy. So once you diagnose NAFLD, simple flow of these patients are 20 to 25% of NAFLD progresses to NASH. Out of that, 10 to 15% progresses to cirrhosis. Out of that, 7 to 8% develops hepatocellular carcinoma, and around 20% of them develops decompensation. Now, very interesting fact is, though patients on NAFLD progress to NASH, they die out of extra intestinal conditions like increased cardiovascular risks, increased malignancy risk, are major cause of mortality among NAFLD patients rather than liver itself. So NAFLD not only increases the progression of liver towards cirrhosis, it also contributes to other kinds of non-communicable chronic diseases like cardiovascular disease and progression of malignancies. So one thing you have to keep in mind, not all patients on NAFLD goes into cirrhosis, but to identify the patients who are progressing into NASH and cirrhosis prevents large amount of complications in them. So 70 to 75% patients will have isolated fatty liver with mild inflammation, very minimal progression to cirrhosis or fibrosis, and 20 to 25% will progress. So we have to differentiate between them. So non-alcoholic steatohepatitis is more serious form of NAFLD in which you have scarring of liver. NASH may lead to cirrhosis and liver cancer, and severe NASH is not reversible. So our aim of doing this kind of public awareness program is catch hold early of NASH. You cannot keep on treating NAFLD in all the population, but you can surveillance the high risk NAFLD population where their chances of progression to NASH is there. So speak to your doctors about your treatment option. You may get fatty liver in your routine ultrasound. That doesn't mean the end of world for you. The only aim of catching fatty liver is to stratify whether you are at risk of progression to severe NASH and cirrhosis, and to properly intervene at from a primary prophylaxis and secondary prophylaxis level so that you don't progress. So diet, exercise, lifestyle modification, and certain medication are used in various combinations. Combination of hypocaloric diet and moderately intensity exercise provides best likelihood of sustained weight loss. So weight loss is the number one thing that has been proven to reverse fatty liver or at least retard progression of mild form of NASH to severe form of NASH. So minimum weight loss that I tell to my patients is 5% body weight to help improve steatosis. But if you want to reverse fibrosis, then to the tune of 10% weight loss has to be done. So weight loss has to be structured. It cannot be done in a hurry and it cannot be done temporarily. A sustained mild to moderate weight loss is what we aim at. So minimum to the tune of 5%, if possible, go to the tune of 10%. More the weight loss, more the benefit. Diet, as we say, Every day, base each meal around vegetables, fruits, whole wheat grains, olive oil, beans, nuts, legumes, seeds, herbs, and spice. Moderate portions of weekly poultry, egg, cheese, and yogurts. Red meat and sweets has to be very, very less frequent. And twice each, you may consider fish and seafood. Exercise. So a weight loss program cannot happen only based on diet. It has to be combined with proper tailored, structured physical activity or exercise. Aerobic exercise helps in reduction of fat, maintains healthy liver, and improves cardiovascular conditioning, whereas resistance training or anaerobic exercise reduces liver inflammation, improves glucose absorption and insulin sensitivity, and it improves metabolic parameters with less energy consumption. So fatty liver can be improved to normal liver with a good amount of exercise and resistance training. Get enough vitamins and minerals, have good sleep, develop an exercise routine, regular medical checkups, eat small meals and frequent meals, lower your sugar intake, eat less of glycemic index food. All this will help you reverse your early stage of NASH or NAFLD. Pharmacologically, your doctor will be the best person to decide. There are certain medications which are helpful. Saroglitazole, vitamin E, pioglitazone. Out of which saroglitazole has been shown to work even in advanced fibrosis for reversal both in diabetic and non-diabetic patients. So the overall tips that I will give you to prevent fatty liver and to prevent progression of fatty liver is quit smoking, exercise regularly, limit or avoid alcohol intake, take prescribed medication, maintain a healthy weight, limit consumption of refined carbohydrate, eat a balanced diet, limit intake of saturated fats and trans fats. Thank you.
Thank you, sir, for this wonderful talk. This has enlightened us. Now we will take questions from our audience with your permission.
Yeah, sure.
So we have a question that what food items we should avoid if we have NASH or to prevent ourselves from NASH.
So I'll just answer your question. I'll just retain my contact details to get in touch with me.
Yeah, so this is for our audience. So you can get in touch with Dr. Nikhil through these details.
Yeah, so to come to your question, the last slide, as I told you, so our aim is to reduce the refined carbohydrate intake, to reduce your trans fats and to reduce your saturated fat. So by this, I mean your consumption of, if you're a non-vegetarian, red meat, too much of muttons, too much of fried food, including cold storage food, which are thawed and fried, like your French fries, potato wedges, which are thawed and then you have to fry and eat that. All those are rich in trans fatty acids and saturated fats. Foods of high glycemic index, which give you glucose surge, like ice creams or too much of sweeteners. All this thing will lead to a vicious cycle of insulin resistance. So reduction of refined carbohydrates, reduction of saturated fats, reduction of too much of high glycemic index food, which is commonly found in red meat, muttons, fried items, your ice creams, your too much of dairy sweets and all that. You have to avoid them. What you can eat is eat a lot of herbs, a lot of spices, a lot of fruits, vegetables, a lot of legumes, dals, protein-based diet, less carbohydrate, normal fat diet is what I advise.
Yeah, thank you, sir. We have one more question. He says that I am non-diabetic. Can I have NASH? Can I get NASH?
So as I told you, prevalence of NASH is high in diabetics, but the other population are not spared. So even a healthy individual without any comorbidity, prevalence of fatty liver is to the tune of 25%. And out of those, at least 1/4 of them progress to NASH. So yes, without diabetes also you can develop NASH because there are other factors that interplay to progress from NAFLD to NASH, like genetic factor, family history, obesity, physical activity, drug intake, amount of herbs or the Ayurvedic medications that you take. So there are a lot of other important variables that contribute to formation of NASH. So you can develop NASH without diabetes.
Right. Thank you, sir. On the behalf of Nash 24/7, I thank you, Dr. Nikhil, for this lively and informative talk. Sir, as you have been emphasizing the awareness for liver health and disease, it is also important for our people affected by fatty liver to regularly visit the doctor and continue medications. With careful observation of precautions, it is possible to obtain control on the disease. I would also like to thank our audience for their active participation and patience in making this event successful. You may also share your suggestions so we can address them in our upcoming Facebook Live programs. So guys, stay connected with Nash 24/7 on Facebook and take care of yourself and your family members. Thank you.